Medical aid group Médecins Sans Frontières has called on the United Nations to add the northwest of Nigeria to its humanitarian response plan due to the high numbers of children suffering from malnutrition. The group says it has treated nearly 100,000 children in the region for malnutrition this year alone. MSF says Nigeria faces worsening malnutrition in the northwest due to insecurity, high food prices and the impact of climate change. Gunmen have terrorized the northwest, killing and kidnapping people for ransom this year. Nigeria is already grappling with an insurgency that has displaced at least 2 million people in more than a decade. It's the second time in 3 months that the medical aid group has raised serious concerns about the malnutrition crisis in Nigeria following the intervention in the northeast of the country in July. Let's speak a little bit more about this with Médecins Sans Frontières country representatives in Nigeria, Dr. Simba Tirima. A very good evening to you and thank you so much for speaking to us. So the figures that I've given about more than 100,000 children, are they still accurate? Is this still the number or does it continue to rise?
The number continues to rise. Well, first of all, thank you for having me. Yes, the numbers continue to rise. We're very, very concerned. Our clinical data is very, very concerning because we have evidence to show that we have numbers that we did not see even last year. I can tell you this, that we have a 68% increase in severe acute malnutrition admissions as compared to the same time last year.
Are there any particular regions that are worse affected in the western parts of the country?
No, I think we have issues throughout. Anywhere you poke around, you will find there is a malnutrition. Currently, we are in 4 states in the northwest: Zamfara, Katsina, Kebbi, and Kano. And I can assure you, we are seeing a lot of kids coming to us, and these are the lucky ones. Some of them don't have access to our facilities at all. And the concern is this, that if they don't come to us in that condition, they will die.
And we know that Zamfara state has been the worst affected by banditry. So some of these children, I'd imagine some of them can even be orphaned by now or lost just within the milieu of parents running away from violence or being killed. Just paint a picture for us what you have to contend with.
Yeah, several things. Of course, yes, there's banditry, there is criminality, and we contend with that. The issue with this is that we have many people who are displaced. We have many people who don't have access to their farms, which means that they are not going to grow food for the following year. And some are killed, of course, but what we see mostly is kidnapping for ransom. And really, I cannot speak very much into that violence per se, but I can say what we see is severe consequences of this violence in the northwest.
In terms of your calculation of the population, a percentage of the population that is affected, is it a majority thereof? And I know we're just speaking about children here, but if children are unable to fend for themselves, that also suggests that there are parents who are absent or who themselves are unable to fend for themselves.
Yeah, of course, everyone is affected, right? But malnutrition really affects young people, and they're particularly sensitive to malnutrition. So I would say probably there are about a million young people, young kids 5 years and below, who are at risk throughout the Northwest. Again, well, there are many factors, okay? Yes, you've mentioned them very clearly. We see conflict, we see global climate change, we see price increases in commodities. I'll give you an example. Maybe 2020, a bag of rice was about $20. Currently, it's $80, so 4 times more, with populations that don't have access to resources at all. Of course, there are certain dietary habits sometimes that historically have been an issue. It's not as if malnutrition hasn't been an issue in these areas, but what we see really is unprecedented. And we're very, very concerned that if nothing is done, MSF is just one organization that's dealing with it. We have maybe 3 others, but that's not nearly enough. And so with that huge population at risk, we must, in many ways, increase our activity to address this issue.
And I understand that sanitary conditions are just some of the conditions that you also struggle with as well.
Yeah, malnutrition is exacerbated by other issues, including water and sanitation. We all have other comorbidities, malaria. Now, of course, in some places we have cholera or severe, diarrhea, malaria, measles. All these contribute to exacerbating malnutrition. So we are contending with that as well. There is no government that can, in those conditions, really be able to rise up to the occasion, and therefore we are calling really for help.
Have there been deaths as a result of this, not only in the West, but I know you're also dealing with the Northeast. Have you seen this occur as yet?
Yes. In fact, the mortality rates that we see is in our facilities 5%, which is really unacceptable. Unfortunately, most of the kids who come to us present very late. And sometimes there's nothing we can do. I'll give you an example. I went to the Northeast not too long ago to attend a meeting, and I went to one of our facilities and I found 2 children being resuscitated, and they did not make it. And so, we can talk numbers, but these are human beings. These are kids who shouldn't die of not having food, of wasting away from malnutrition.
So what are you asking the UN to do in terms of either changing its assessment or refining it?
Yeah, well, by the way, it's not only MSF that's outspoken about this issue. We have a chorus of voices. Even the states themselves have seen that this is something unprecedented and beyond their capacity. So we have a chorus of voices asking that the Northwest be included in the HRP, as you mentioned earlier. The reason for this is funding. The way that global funding is structured is that if we're not included in the HRP, it is unlikely that we will get the sufficient funds that we're looking for in the Northwest to address this issue, because governments rely on what is on that HRP to the donor countries to fund something like this. We're not asking money for MSF. No, MSF has independent funds, but we're calling on the international community to really rise up to the occasion and assist these kids who shouldn't be dying. By the way, we're not saying that we should rob Peter to pay Paul. That is, we take from the Northeast to bring it to the Northwest. No, that's not and we're not creating a hierarchy of victims to say that the kids or the patients in the Northwest deserve more than the ones in the Northeast. No, we have a problem in the North. And again, you very well listed the factors that, or the drivers of some of what we see.
And I'm just thinking, as you say, that it's not necessarily a competition, but there are other exacerbating things, like we're moving towards the peak season of malaria. So in terms of UN funds and how they're structured as well, I'd imagine that this is where they'll be dispersing some of those funds.
I think so. Well, and I might, let me add this. The UN really has very warmed up to this idea, and we're very fortunate to have a humanitarian country team that is very, very receptive to what we see. The RC, that is a resident coordinator of the UN here, has visited some of our facilities, and he saw firsthand what's going on. And during one of our meetings, he expressed shock, actually, with what he saw. So again, we are seeing a movement that is very positive, and a lot of actors also calling for this to happen. Now, we are in the lean season meaning it's a rainy season, people are planting, they've probably depleted the stocks of food that they had last year. And so we're just really in the middle of it. And the numbers we're seeing, unfortunately, are way above what we saw in the past years. So again, it's something that needs action immediately. Well, even if we include the Northwest and the HRP in one form or another, of course, mobilizing funds will take quite some time. Mobilizing actors will take quite some time. So in the meantime, there is need to have something going on that can, in many ways, intervene in this very, very precarious situation.
So to sound the alarm once again, as you say, it won't arrive immediately, but what happens in the meantime while you are still waiting and pleading for more resources?
Unfortunately, kids die. This is the reality. As we speak right now, there are children dying of malnutrition, right? And look, we're not asking for a protracted, intervention like we have in the Northeast. No, we're calling for this immediate attention in probably 3 areas. Number one, treatment for complicated cases that are admitted, right? We need to shore up that. We need to increase that. We need to scale up, right? We need to scale up what we call outpatient treatment, so that we catch some of the patients before they get very complicated. And then we need blanket feeding. This is the purview of agencies like WFP, where these communities don't have food. Give them food, blanket feed for a certain period of time. While we observe what happens. And then in the long run, we of course have to look at issues of food security, issues of and how do we build resiliency when it comes to global climate shocks. Working with FAO, Food and Agriculture Organization, working with meteorology departments to help farmers to understand the variability that is very unpredictable.
Dr. Tirima, thank you so much for your time, and all the best in your efforts to galvanize funding and, of course, immediate action. Médecins Sans Frontières country representative in Nigeria, Dr. Simba Tirima, who warns that children are dying in the northwestern parts of the country as a result of malnutrition. He says the same is happening in the northeast as well. And as you heard him mention, those 3 areas in which they are calling for urgent action.